Hi, I'm Dr. Jason Garrett with Airrosti Rehab Centers. Today we're going to discuss something that's going to affect 90% of Americans at some point in their life, low back pain. More specifically, lumbar disc herniation, one of the most commonly diagnosed, yet least understood types of low back pain. We're going to outline what a disc herniation is, how it's poorly managed, why it's misunderstood, traditional treatments for it, and how Airrosti effectively resolves most lumbar disc herniation related pain. First, let's talk about the basic anatomy of the lumbar region. You've got 5 lumbar vertebrae separated by intervertebral discs. This disc you have to think about like a jelly donut. It's got an inner jelly-like material surrounded by an outer fibrous material. And when you injure it, or when it herniates or protrudes, that inner jelly-like material herniates back and can press on a nerve root, which then can cause pain to radiate down your leg, cause numbness and tingling and some pretty bad pain. Now, does a disc herniation always cause pain? No, as a matter of fact, 60% of people, according to the New England Journal of Medicine, have a disc herniation with no associated back pain whatsoever. So if you're watching this video right now and you don't have back pain, you have about a 60% chance of having a disc herniation and you don't even know about it. So somebody goes out on the street, they bend over, they pick up something, they strain their low back, they end up having back spasms, a lot of pain in their low back, maybe some radicular pain, some numbness and tingling coming down the back of their leg. They go to their family doctor, they get a diagnosis of low back sprain strain, get some NSAIDs, some non-steroidal anti-inflammatories, reduces the inflammation, patient goes out, but the pain doesn't go away. So they come back, the doctor recommends physical therapy. So 6 weeks of physical therapy, they go through that, the back pain is still there. The next step is, obviously, you do an MRI to make sure there's nothing significant going on in the back. Well, now the person has an MRI and they have a disc herniation. Did they have the disc herniation there before? Maybe, maybe not, but now that there's a radiographic finding that shows a disc herniation, that becomes their diagnosis. The next treatment is, well, let's do a cortisone shot or an epidural steroid shot deep into the spine, into the disc in this area to reduce the inflammation. If that doesn't work, the next step is they go in and make an incision between the muscles, chisel away muscle along your spine, go down and actually physically remove the herniated portion of the disc. Then the person wears a back brace for a little while. For another 4 to 6 weeks, they're walking around, not really stressing their back. Their back pain goes away, but it may have been an unnecessary surgery because it may have just been a traditional low back sprain strain that was poorly treated to begin with. So what makes Airrosti effective at treating this type of injury? Well, first, we spend an hour of quality one-on-one time with every single patient. This allows us to do all the functional, neurologic, and orthopedic testing to arrive at a much more accurate diagnosis. And because we do this, it eliminates the need for unnecessary MRIs, CTs, injections, prescriptions, etc. And because we've arrived at an accurate diagnosis, we can then apply a very specific hands-on manual therapy to resolve this type of injury. After the treatment, we follow up with functional testing to ensure that we've made a significant impact in the patient's overall pain and dysfunction. And then we follow up with active rehab, no passive modalities or chiropractic adjustments. There are literally hundreds of different causes for low back pain. And just because you've been diagnosed with a lumbar herniated disc, remember, according to the New England Journal of Medicine, it is a very poor clinical indicator for pain. 60% of people walking around out there that do not have back pain have a lumbar disc herniation. So you owe it to yourself, if that's your diagnosis, to come to Airrosti, where we'll properly assess and diagnose you and get you on the road to rapid recovery.